So happy to see you all, and thanks for coming. I'm Patty Doikis. I am a proud Dartmouth College 86, and the great class of 86, and I've had really the honor first of knowing Lisa for, 15 years or so, and then being part of the board for the Center for Health Equity. So thank you so much for being with us today. We have, and being in community together for the center, for all of the communities and partners that the center does have, and to celebrate the 10-year anniversary, which when we started, we were just going month to month, day to day at the beginning. So really, really proud of that. And not just for the center itself, but of course, all the impact that the center has had, creating all these different educational opportunities for Geisel students, for Dartmouth students, for our partner institutions, and they for us as well. And also working with a number of communities around the world, certainly in our own backyard, here in the Upper Valley, and then elsewhere in the U.S., and of course outside the U.S. as well. And, before COVID, before George Floyd's murder, a lot of the world was not awake to the health disparities and inequities and injustices that exist, and also all the systems and processes and policies and practices and norms that keep those in place. But of course, Lisa, throughout her career, has always been thinking about inequities and what can be done about it. So we're so fortunate to have her and brought that to Dartmouth and to the Geisel community, and really made such an incredible difference, certainly in my life, in understanding this and many others. So my job today is to introduce Lisa. I've done a little bit already, but she is not only the director, obviously, and founder of the Center for Global Health Equity, but she's also the Associate Dean for Global Health. And just as an example of her incredible work that goes beyond what she does here and with our partner institutions, she also does things like goes to the Lancet Commission and gets them to think about the Arctic North and indigenous communities there together with other partners. And she's just back from a wonderful meeting there to accelerate the health and wellness of indigenous communities in the Arctic North. So just a little bit of what Lisa's been doing, I think emblematic of what the center together with partners is able to do. So we have a wonderful panel for you today. Please enjoy it, and this is just the beginning of many celebrations going forward. So welcome Lisa with me, please.
Thank you. Oh, thank you, Patty, for that very kind and generous introduction. Your partnership as my guide, as my sounding board, as my friend, has really helped us get to this moment. And I remember sitting across a table with you in the hospital cafeteria 10 years ago when I started telling you about this new center that was being launched at the medical school, focused on health equity, and how I was being asked to lead it, and how I was needing to put together a board. And before I could pop the proverbial question, that question where you ask someone to be on your board, you turned to me and said, I would love to. And that was how it started. You've been with me every step of the way. And so a profound thank you to you. So I can't believe here we are now, 10 years later, and I'm so happy to share this occasion with all of you. I see so many friends and colleagues, mentors and mentees, and true partners in this room. And it means a lot to me and really to all of us to have you here. So before I introduce our speakers, I just wanted to say two quick things. The first one is that launching and leading the first global health programs at Dartmouth has been the highlight of my professional career. The rewards continue to outpace the challenges and keep me focused on what really matters. Which leads me to my second message, which is my immense gratitude to all of you. You, along with our many partners across the globe, you are the heart of this center. And so what a privilege it has been for me to work with our smart and committed students who have pushed me to keep thinking forward. To my colleagues and mentors who have paved the way and continuously inspire me to pay it forward. And to my amazing board members, past board members, some of whom are here, and current board members. You have been my wise sages, my reality checkers, sometimes my reality suspenders, my nudgers, and my best cheerleaders. And to my Center for Global Health Equity staff and team, Tekla Coleman and Kelly Burgess, just wave so people know who you are if you haven't met them. You two who deal with the day-to-day operations of our work, my crazy schedule, you are the ones who made tonight's event happen. To our supporters and generous donors who heard our stories, believed in our potential to get this right and serve our constituencies authentically. And to our many partners on campus, and with a special show of appreciation to the Dickey Center for International Understanding, Tori Holt, its director, and Don Carey behind her, who are here with us this evening. Our key collaborators and co-conspirators in this work who have supported me in my roles and is hosting us this evening in this beautiful space. And of course, to our domestic and global partners, my many colleagues and teachers and dear friends at our main partner sites in the Upper Valley, in Dar es Salaam, Tanzania, Pristina, Kosovo, in indigenous communities in the Arctic, and in Kigali, Rwanda, among others. It always takes a village, and with you as my fellow villagers, this is a neighborhood I want to live in for the rest of my life. So I now have the honor of introducing one of our key partners, my dear friend, colleague, co-author, mentor, and global health hero, Dr. Agnes Binagwaho. So we took the liberty of providing bios in the program, detailed bios, so that I could keep my introductions very short tonight. So you can read about Dr. Agnes's impressive credentials, her many leadership roles nationally and internationally, learn about her role in turning around Rwanda's healthcare system through the novel Human Resources for Health program, an educational collaboration that since 2012, I and over 40 Dartmouth clinical faculty have participated in. From the beginning, Dr. Agnes insisted that health, physical, mental, social health, is a human right for all. And when you take that stance, it changes everything. For me and for many of us in this room, it's been an honor to work with such a committed, dynamic, and inspiring champion for global health and human rights. One who asks us the tough questions to make sure we always prioritize the communities that we serve. So join me now in welcoming someone who is truly bending the arc of the universe towards justice, Dr. Agnes Binagwaho.
Thank you, my dear. Don't believe everything she said. I'm very happy to be with you all here today. It's an honor to be invited for the 10 years of this center. And I have to say that I was here when it was launched. And seeing what has been done since then, congratulations. Congratulations, because as you say, it takes a village to do so. And it's not the work of one person, it's the work of the village. So, health is multifaceted. And it's linked with many factors beyond the wall, the clinics. And you have implemented such idea since the beginning. And you promote investment in socioeconomic factors. You explain also the importance of sociopolitical stability. You cannot create health equity when there is things are not working, and also that things that are important for health are not necessary in the health sector. Sometimes we need a road. for the people to go to that health center and not to create another health center here. So that with the economy, we can buy material and recruit more nurses and doctors. So all this, in my country, I think we have done well. But we have done well not alone. We have done well using the partnership of the great friends we have in our surrounding, Uganda, Kenya, Tanzania, Congo East, but also all over the world, here. Thanks to many people who have accepted to leave their home for 1 year. Because at that time, people were coming for 3 months maximum. You remember? They come for 3 days, they stand the land, they give the lecture, they go back home. So we decided to change the done because we need another type of partnership. And I remember when I say, I want people who stay with me during a year. Everybody said, nobody will come for a year in Rwanda. Don't even ask. And I say, I will ask. Because it's what we need. If we want really to give the country the capacity to take over, we need that approach. And we were lucky at that time. There was some revolutionary people at a house that we call White. And in the beginning, they said, Agnes, if you want to put your money there, you will simply lose the money. And I said, okay, I will go to your Congress one day, trust me, and I will tell them that if we are still demanding 20 years after, it's just because you don't want to follow the group. And they say, Agnes, don't do that, we want. And we work together and we make it. But to make it, it was a great challenge. Oh my goodness, and a great plan. And we had a lot of fun doing it. We planned what we were missing as educator. And with friends here, they went to university, asked, who want to come to teach this, and this, and this, and this? This is what we need to teach. This is what we don't have. And we make it. It was a crazy plan, but we had crazy revolutionary people who accept to feed the bucks, and others who accept to let us do it. Because we say, we don't want more money. So forget the money. We just want the authorization to use the money that it's already dedicated to the country for that. And I remember somebody telling me, no, the money is for HIV. If you don't need it, I say, we keep the money for the drugs, but our nurses will give the drugs. Our community health workers will follow. But we need high qualified people to educate our people to train so that we can train people forever. And we make a plan, and it was successful. And Rwanda, from this, reached that. We are still among the 30 poorest countries in the world, but come and watch our health sector. You have a lot to learn from it. You have a lot. But this is just because of that partnership. Everybody came and bring the best of his knowledge. Everybody came and worked together as one, under one plan that was national. And when somebody didn't want to work around it, we just say, it's that you have somebody better to propose. And if they say yes, we put everybody around the table and we change our plan so that everybody have only one choice, follow the plan. And that is the only way we can measure ourselves against success. So it was very exciting. It was fun because we just have an idea and we just say, how can we make it? And we just go on our phone, we call somebody kilometers away, say, what do you think about that? And we dig together. This is true partnership. And now, Rwanda is still among the 30th poorest country, but our health sector is one of the models in the world. Thanks to the education, thanks to the partnership with many of you. So, I had a speech, and I don't follow it like usual. But what I wanted to say is that this institution was crucial from the time when Jim Kim was the head here. And the focus on allowing global health innovation has allowed other universities to follow. You know, it's not being, the big problem of many institutions is to be the first, doing something that has never been done, and that seems very, very, very bizarre. But in here, because of the friends we had, because of the trust we had developed, we have managed. And when Dartmouth go, I can tell you the others feel ashamed not to. So we had 23 institutions of higher education in the US who brought 100 teachers. Not for 3 days or 3 weeks, for a year. And we create a model of twinning, or a promising Rwandan with the expert foreigner. And they teach together with clear transfer of capacity in teaching. And after 3 years, we had what we wanted. And as we say, I remember discussing that with in a house called White. They say this is not what the funds are meant for. And I say the funds are there for treating people. And we need our own people. We cannot rely on outside forever. We can rely, and it's not that we are not going to continue to depend on each other, but we better depend for something more sophisticated and more sophisticated. And when we reach the level we are together, we can go together, help another country. And we were lucky to have people who have understood that. And we create a great team. I tell you, it was fun. And sometimes very surprising. I cannot say everything, but I remember things that I was alone in my office at 9 o'clock at night, and I was laughing just because of some definition. There is nothing more special than an American lawyer. I learned that. And all those documents were MOUs and MOUs, etc. With the medical people, etc., totally normal. But with the lawyer, sometimes they were so strange that we just have to go and say, what do they mean with that? What is the implication if I sign that? So we invent something. We did it. It was very hard because it has never been done, and Rwanda was not an easy country. It was not like Kenya where you have nice beach, etc. So people were not necessarily attracted to come into Rwanda, but all the people who came fulfilled their mission so well, and we create bonds that are still going on now. With our students, many of you are still in touch with the students they have educated and the research you have done. And it was really a fantastic time that taught us that going out of the boundary is necessary when you want to go fast. You have to leapfrog. And you don't know that you really land here or there or there. But you have to go forward. And you can do that with trust because you are with friends. You are with people who really want the world to be a better place and who really believe that all places on earth matter. So my speech is there. Well, but what I want to tell you, it was a great story. You can read a little bit about it. We should write more about it because it's one of the biggest partnerships ever in education, ever. We didn't document it enough. And also, it brought to the US capacity to do some research in Africa that was useful. And it helped my country to really take off. So, take off in education, allow you to take off in health, allow you to have a healthy population, allow you to take off in economy, allow you to accelerate your development. So it's not a little thing. It was a great thing. A great collaboration, a great friendship. And now, with the world where we are, it's more needed than ever. We should push countries, people, institutions to do the same. Because the climate change is a danger that is in front of us that is going to be far more scary than anyone can believe. All the fight we have done to save mothers and children, we may lose it because the traditional way to produce food will be lost for a big part of the world that is not responsible of this. So the victim doesn't even understand where it comes from. But when you see the fact that bees are dying, pollinizer, I don't know if it's the right word, are dying, and countries are not ready to do that artificially, what are the poor people going to eat? And it's not in 10 years. It's there. So we need to come together again, because if we do nothing, what is in front of us is going to be far more dramatic than what we face with HIV, for which we have came together and changed the world. And it will impact also all of us. So I think there will be questions after. I'm not going to pass through my speech and say just thank you for listening to me and ready to answer questions and to discuss those subjects. But I'm very, very thankful to people I see up and down. We have done so much, and also thank you for always responding to my call when I took the phone, and sometimes we strategize, you know. Say, I need the house that we call white to decide this, and they want to decide that. Or do you know a friend who can help me? I remember. And they say, who give you my address? How did you come here? But everything went right. And it's so good because good people are everywhere. Just take the time to find them. Thank you. I say questions.
Yeah, we have time for questions.
Oh, yeah.
Couple over there. And yeah, we have a microphone, as it might be live streaming, and there is a recording, so we want to make sure all the questions.
Hi, My name is Xavier. I'm a first-year medical student at Geisel, and I wanted to thank you to take the opportunity to share your story with us. My first question was like, in the midst of like all these amazing changes that you've done, what kind of pushback did you get both from, you were talking about pushback from political organizations in the US, but what kind of pushback as well from political organizations in Africa were you able to get to implement those changes? And my second question was, after all those changes have been made, like what was the impact on that? Because I think Rwanda has done a lot of like progress, both like in the healthcare sector and economically as well. Like, what do you think the impact of like changing the healthcare system produced on that?
Economic.
On that rise, on that economic
so
rise of
come
Rwanda.
back to your first question because you spoke so much.
My first question was more on the pushback, like
the pushback I had. Okay, I had many pushback, but by almost everybody in the beginning, but most because we were going in an unknown area. You know, I was proposing things. Even good people were very, very skeptical because it has never been done, never been proved. And also, their administration are not kind. I am sorry for you. The administration in a house called White is terrible. Because you need to go for what has already been proven. You have a Congress who vote with the knowledge of the past. And to go around this is not easy. So it's not that people didn't want. Sometimes they were at risk to do that. And they have taken risk. You have also, at that time, the World Bank, who was really very traditional. And what we wanted to implement in Rwanda was totally, new. Totally new. And people doesn't like new things, because if it fails, they lose their position, even here. So people are against you, not because they are bad people, but because systems are created as such as the system is not necessary for radical innovation. So I have to recognize people who have taken great risk to follow what we have done. There is also, with time, trust that has been created. And I remember people saying, will you still be in position? I say, no, I'm permanent secretary. It's permanent only in the name. It's every 24 hours, I'm permanent. But if you are not there, I'm not sure it will work. I say it will work because So it is this that when you go for innovation that are totally new, you need to guarantee success to the people who help you. The second one?
Sorry, I don't want to take so much time, but like just as a follow up, like what are the things that you think were really helpful? You talked about the partnership, but what are the things you think that were really helpful to be able to get those traditional institutions to be able to like be by your side and to be able to implement the program that lasts even beyond you being in the position?
I will tell you, as you travel, identify good people. And when you have a question, take the phone first and call them. Because many things has been done like that, on trust, friendship, and the certitude that you will make it. But if you want to do that, make sure that you are the best fighter against corruption. Because in this type of partnership, for example, we took all the money of PEPFAR that was there for HIV and we turned it to buying the drugs, but all the rest, buying education capacity. And in that, you have to be sure that there is no. So if you have a country where you manage to fight corruption, just do what is needed for your own development. It's not the same as mine. It's not the same as here. And also develop friendship, people who can trust you. The other thing, write a lot. There is no more advocate. The biggest advocacy, it's an article in the Lancet. Stupidity. Yeah? But they believe that because they publish that in the Lancet, it's the Bible. You say? So write, publish, develop friendship, and really be accountable.
Hi. So my question is, I've noticed a lot of times in global health, especially as it relates to Africa, there tends to be a lot of paternalism and neocolonialism, almost an unwillingness to let Africans speak for ourselves. And so I was just kind of wondering if in the course of everything that you were trying to do, if you ran into like a similar situation or if you saw those same things, and also like, how did you go about navigating it, not just for the inception of the workforce, but also in terms of like maintaining it long term, like the healthcare system in Rwanda?
So I think that in the world there is racial issues, and the Black communities are in the bottom of all the scale. And in society, the woman. So a Black woman is. So you had to fight everything, and never forget it, never give up. That means if you are in a field, be the best. Make sure that nobody can shut you up for your capacity, so that you can challenge them for the gender ideas.
Thank you so much again. I think one of the things I love most about your work is how practical you are. And I think one of like your successes was like giving the HPV vaccine to 93% of like 13-year-old girls in Rwanda. And I just wanted to ask like what strategies that you actually used to achieve that feat and maybe others. And I'm specifically asking this question because I know when COVID like started, there was like this, I guess, in the news, it was basically saying that like COVID vaccine is not really like distributed to this poor countries in Africa.
So that's many questions.
Sorry.
Okay. First one is what?
So the first one was strategies that you used to attain that success in Rwanda in HPV vaccination.
In doing vaccination?
Yes.
So Rwanda, there was a study done by Gallup Institute and Wellcome Trust. Rwanda is the country where the population trusts the most the health sector. I was very proud. And this explained that, meaning you go to a population who never saw a microscope, doesn't imagine what a virus is, a bacteria, doesn't see the link between something they don't see and something they feel. And you say, I have here, if I inject you that, you will not feel it. It needs a lot of trust, isn't it? And because of the trust, and that study has explained that if the population in Rwanda has high trust, 93% of the people trust the health sector. In this country, it's not 60%. There is no mandatory vaccine, none. But we have 93% of our kids, age 12, fully vaccinated for 11 vaccines. So, this study of Wellcome Trust and Gallup Institute has put the point on you need to cultivate the trust between the health sector and the population. And unfortunately, to cultivate that trust, it's not in the hand of the health professional only. If they don't trust the judiciary system, the trust in the health sector is low because if they are mismanaged, they don't know where to go. If they don't trust the executive, same. Because even if the judiciary system issue a resolution in your favor, the executive sector will not implement it. So the trust in the health sector depends really in the trust of many other sectors. But because you know that, you can work on that as well. And it's very, and the population know when you do things for them. I don't speak Kinyarwanda. I'm very bad in language. I had the choice to learn either English or Kinyarwanda. English is easy. I don't speak it well. It's okay. You understand what I'm saying. Kinyarwanda is quite difficult. So I decided to learn Kinyarwanda. When I'm with the population, I take somebody to translate for me. And I was so surprised they understood what I wanted. And they trusted me. So trust is really about people understanding that you do the best you can for them. It needs also to stand up for them when they are when they have problem. It needs just to go for the truth, but they will always know.
Thank you so much for, let me try to make sure I don't echo. Thank you so much for a wonderful talk. You make really complicated things sound a lot like common sense, and you've actually been able to implement it in such an incredible way. I wanted to ask you a little bit about your vision for the future. We're here, it seems like 10 years, but I have the hope and the feeling that this is just the beginning, both of the partnership. So I was hoping you might share your thoughts of what do you wish for in the next 10 years for the Center for Global Health Equity? What would you like to see, and what can we work together to do together?
To continue to improve the world, even a little bit more deeper. Stop to look to each other in the eyes and start to bring other people who didn't benefit. This is our mission. There are many vulnerable people around the world, in every country, that have nobody to stand for them. A vulnerable person is a vulnerable person. And we have a global mission. My mission doesn't stop to Rwanda. So we need to start thinking about international laws that are unjust. Let me give you one, for example. Africa has bought COVID vaccine. We bought COVID vaccine, not Africa. Rwanda bought with his own money 300 doses. Germany came and took that in the factory. Even in the airport. So that means this is pirate. If we have done it, we'll be in jail. Germany did it. The government got nothing because it's Germany. So we had to wait the next branch of vaccine. So they got nothing because the world functioned with a white supremacy mindset. Even nothing in the journal, just a little thing like that. So there is a lot to do. There is a lot of international law to change. The work is immense. So let's go and work.
Let's take these last two questions. You raised an excellent point around the impact of climate change, particularly in our equatorial countries around the globe. and the impact of global climate change on health. Where do you think we need to focus first? Food? Or in something else in terms of how to address the impact of climate change in the most direct way to help our vulnerable populations?
So not only food, because there are diseases coming. And as always, that nutrition, with nutritionists, focus on food. With agriculture, focus on production of the food. But with the medical staff and nurses, etc., focus on how to manage it, how to deal it. Focus on talking to the people. People have to eat things produced differently and to contribute more to the production of what they eat. We need to change all those big farms with a lot of pesticides that are killing the natural way to produce food. We need to stop it. If not, poor people will die. Nutrition, the food, ordinary food, is going to be out of the reach of the pocket of the poor if we don't move. So there is a lot of things to do, but we cannot do one thing, everybody. We need to sensitize everyone to work in this field. Teachers with their students. Leaders with their people. Agriculture with the way they produce and what they do. It's going to be bad. People doesn't get it, but it's going to be a catastrophe. 30% of the pollinators are dying every year. 30%. So what is... It will be done, but in a way that it's so expensive that people will not... Ordinary people will have problem to afford it. Or it will be of poor quality.
So my question was actually related to this climate change question. And so just to take it another step, what I find so complicated about the climate change is in many parts of the world, there's silos between the health system and agriculture and nutrition. And to solve this requires putting them all together. And I was just curious as to how you're thinking about that from the health system's perspective and what lessons learned from the last 10 years in this partnership that might be useful for solving that problem.
I think that the production is beyond the health sector reach. It's something else. It's another sector. The health sector is there to alert and say, if we continue like that, or the education sector, if you continue like that, people will die. And because people doesn't feel it. People feel, for the time being, we are still in this way to be better. But we need to alarm, to alarm more and to go to politicians, inform them. They could do propose laws that may change where we go. And you can do that here. We try to do that in African Union. We have to do that all over the planet because nobody wants to be the first because they will lose money. And this is dirty money they will lose anyway because the population will die. So we need to, like we have, create regulation for drugs and drug transportation. We have to start to do that for food. Food is medicine. Don't wait the people to be malnourished to start reacting.
Thank you. Thank you, Dr. Agnes. You're always good at giving us these calls to action. And that's what we need to hear, and that's what we need to heed. So.
Go to your politician and tell them that what they do is killing the world in 10 years and they can stop it if they want, and you are ready to help them because they don't know how to do it. That's also something we doesn't have to complain, we have to act.
Well, thank you. Great. I would like to invite our panelists now to join me up front. And as I said, you can read about the impressive bios of our students and young alumni in your program. So I decided I'm just going to say one personal thing about each of our panelists, but don't panic. I am going to introduce our panelist, who is managing a lot, I know, today, and no worries. So happy to have everyone here. And I'm going to start with Dr. Claire Wagner. Mine too. So, Dr. Claire Wagner, from taking my classes in those early years to being my first student intern, I trained her up for you. She set the bar extremely high for all those poor student interns that came after her. To our working together in Rwanda, I've watched your career in global health equity soar. And Claire let me see how a mentee can mature over time into a revered and deeply admired colleague and a lifelong friend. Dr. Adrianna Stanley, I had the privilege of mentoring Adrianna as well through her different involvements in our global health programs. And even with the stresses of medical school and life, she always entered my office beaming with optimism about her endeavors and about her unwavering commitment to social justice. Those meetings always lifted my spirits. Meave Otieno. I met Meave when she interviewed for our Ford von Rhein research elective in Dar es Salaam, Tanzania, working under Dr. J. Bucky's mentorship. And I was immediately struck by Meave's poise and her elegant description of how witnessing health equities during her earlier work in Tanzania and Zambia drove her to engage in research that could improve health outcomes for millions worldwide. And our last panelist is Juliette Courtine. Juliette is one of those undergraduates who quietly changes the world. Combining her interests in health and Indigenous studies, she worked in the Northwest Territories in Canada with one of my co-authors on that Lancet report, which, because it'll be published in the Lancet, will hopefully get attention because it's a neglected area in global health. And Juliette's someone who sees health disparities that have been historically overlooked by others and then finds her place in helping to alleviate them. So I'm going to turn it over to our amazing panelists now. They're going to do a little bit of a lightning speed round of comments, and then we'll open it up again for conversation and discussion with all of them. So, great. Thank you. I'll turn it over to you. You want to start, Claire?
Hi, everyone. Thanks so much, Lisa. Thanks so much for having us. Those stairs, I used to run up and down those stairs when I was your intern, and I tell you, carrying a four-year-old up and down those stairs is a totally different activity. So I apologize, I'm a little out of breath. Which actually says less about the 4-year-old and more about my exercise levels. But really great to be here with you all. And I think there's so many ways that one could focus one's talk about being back here, celebrating the center, celebrating Dartmouth's involvement and leadership in global health, celebrating all of the really the gratitude that I feel towards so many of you in the room today and the mentorship that you provided me. But I have been told that I need to narrow down to just a couple of comments around how Dartmouth is such a special place for being steeped in all that is global health equity. And so a few things do come to mind. And Lisa, these are all really centered around you. So, but the first one is on mentorship. And this is something that I think Dartmouth as an institution does very well in general. I felt that way across my coursework here, but really one of the ways that I think being part of the global health ecosystem, for me, it was part of the Dickey Center's Global Health Initiative, working for Lisa, was that there was no shortage of bets that were taken on me. And what a thing that is for an undergrad who really knows nothing. I'm like a pluripotent stem cell sitting there with no knowledge, right? Just ready to be shaped into whatever thing I'm going to be. And there you were, and you were like, well, why don't you try this? Or maybe try this over here, or try that over there. Go to Tanzania and do this other thing. And I think that is such a critical lesson for, now I get to be in the role of mentor in some capacities. And it's a lesson that I carry with me, and one that I know Dartmouth does incredibly well. The second is a lesson around persistence. I think there's a real, as you just heard from Dr. Agnes, there's a real whatever it takes mentality in the kind of global health equity ecosystem that we are in. I mean, we, like in this room and listening to you, Dr. Agnes and Dr. Adams, and that whatever it takes approach is something that I first learned here at Dartmouth and under your leadership, Lisa, and I feel so grateful to have learned that early on, which has carried forward into a lot of the work that I get to do now at the Bill and Melinda Gates Medical Research Institute, where we develop pharmaceutical products for diseases that have major global health burden, but also limited commercial incentives. So diseases like tuberculosis, malaria, enteric diseases, maternal, newborn, and child health. And on the clinical development and the preclinical development side, it is certainly a whatever it takes approach. And I personally lead our access strategy. So how do you bake in access and supply and availability and equity into your clinical development plans, and into your delivery plans? I think that's such a foundational tool for all global health practitioners, if you will, broadly defined, and something that Dartmouth does very well in teaching us. And lastly, I think the one thing I noticed just being in this room today is the community that is brought together. Dr. Agnes referred to it as the village, and that you could, and our friends and so forth. But I think there's something kind of intangible there around feeling like you matter in this space, and that's I felt that as a trainee here, as an undergraduate trainee here. I felt like I mattered. I wasn't doing very many big things here, but I really felt that, and it's also because you feel that, you know that it feels good to feel that, and so you give that back, and you want others to feel that they matter, and that is a really special sauce that Dartmouth has, and not something that I've found everywhere. Right? It's something that Dartmouth really has strongly. So, thank you for the opportunity to share these reflections, and I look forward to hearing from you all.
Thank you so much for sharing that. And thank you to Dr. Adams and to everyone else who helped coordinate this wonderful event. It's amazing to see how the center has grown in the past 10 years. And I really started engaging with the center in its first or second year in 2014. And I was so fortunate to participate in so many of the center's programs. So I was a global health scholar for the first preclinical years, and on campus I would help with speaker events and lecture series and engaging the rest of our medical student community in issues of health equity. And then I had the wonderful experience in my first year as a first-year medical student where I knew nothing. I was also a pluripotent stem cell. And I was asked to join one of the center's illustrious surgical colleagues, Dr. Vernelli, to go with him as a Spanish translator to Guatemala and to help provide cleft lip and palate surgeries to some of the communities in Guatemala. And it was at that experience that I first learned about truly having partnerships with the local community. And I think partnership has really been a theme that I learned at Dartmouth and that has been progressed throughout the rest of my career so far. And one of the most important things that I learned in that experience was the idea of capacity building with the local community and providing post-surgical, post-operative care so that these communities could continue to have continuity of care after we were gone. And it was an incredible experience just to have as a first-year medical student. And then I did some other things I had the wonderful mentorship of Dr. Adams, who really helped me have fantastic experiences in Peru doing malaria research. And then in my fourth year, I participated in one of the DARDAR programs. And again, to see the longstanding partnerships was incredible. I spent 8 weeks in Tanzania doing an internal medicine and pediatrics 8-week clinical elective. And I went on rounds with the Tanzanian medical students. I attended lectures with them. I remember attending a malaria lecture and thinking, this is an incredible opportunity for me to be learning from the local community, from the experts who see this disease day in and day out and, are the experts in treating this disease. And I just felt so fortunate to have had these experiences. And so from then, I decided to pursue a residency in internal medicine and pediatrics. And I chose a residency program at UCLA that has a very similar approach with strong partnerships that I was able to participate in as well, with very similar sort of cross-cultural exchanges and just using the themes from the Center for Global Health Equity throughout my residency experience. And then now I just graduated residency 3 months ago, so I'm a fresh attending with all the jitters. And I do primary care up in Sacramento, California. And I work for a federally qualified health center. And I really feel that the institution that I work for has its values centered in health equity. We served Sacramento's most underserved populations. We serve the unhoused, we serve the undocumented and the uninsured population in Sacramento. And I definitely would not be the primary care physician that I am today without the Center for Global Health Equity's experiences. So thank you.
All right, so my name is Meave. I feel very honored to be up here with such great people. I feel like imposter syndrome is a chronic condition. So prior to Dartmouth, I feel like I was born in Kenya, and we came into the US as immigrants when I was around 9 years old. And at around undergrad, most of my friends were international students. And that's when, to me, I made the decision that, since I'm pursuing medical school, whatever I end up doing, I want to be back in sub-Saharan Africa educating future physicians. So it was basically how do I get there type of thing. So prior to Dartmouth, I did a lot of work in several countries in sub-Saharan Africa. And when I came to Dartmouth, interestingly enough, I was like, this time I'm just going to focus on medical school. We're not going to chase this, what country am I going to next thing that I've been doing. So focusing on medical school. So I'll say the Center of Health Equity found me. I wasn't looking for it. It was so I came in with a class of 2019 and I'm taking an extra year graduating this year. So it was last year when my friends were graduating that one of my friends who went to Tanzania with me, Marilyn, she's now at Stanford doing a global health track, internal medicine residency. She saw an email and she's like, Meave, why don't we apply to this? And I was like, it's like, I don't know. Like, I don't know if like they'll accept me. And she's like, you've like done so much. Like, I haven't done anything. Like, why would they accept me? So like, let's do it together. So we applied. So she did the clinical tract and then I did the research tract through Ford Von Rain. Did not know what to expect. I ended up being selected to work with Dr. Bucky, working with children living with HIV. At that time, I was interested in pediatrics. So that's how that happened. And so we were gonna, they talked to me about like the kind of projects they were doing, and through just back and forth conversations with Dr. Bucky and Chris, came to this idea that we could look at the effect of antiretroviral regimens on cognitive and peripheral, like auditory processing in children, which is still doing that analysis for right now. But like they were very excited. Like it was like, just jump in, Meave, you like lead it. You do what you want to do, but we're here to support you. It's a lot of neuro. Neuro is not my jam, but like they were there to like help me understand what we're doing on the neuro side. There's like some ENT involved as well. So like, and Chris is like super amazing with his explanations and kind of guiding my research. And what I appreciated, like once I was in Dar es Salaam with like the Dar partnership, it's like for me, even in my past, whenever I look into working with an organization, usually it's US based in a sub-Saharan African country, like I want the relationship that organization has with the community to like be established. Like I don't want to go in there and like be the one that is like trying to establish myself and like earn trust. Like if they already have trust with that program, it makes working there so much like better for me and the partners there. So when I was like at Dar, they were super excited to have me. My on-site supervisor, Dr. Magohe, like from day one, like picked me up from the airport. I was just like, okay, it's going to be a great experience because it's like, I don't have to work. Like when I get to the clinic and I'm working with the patients, I won't have to really worry, like, do they like trust me? And furthermore, like Dr. Magohe, at that time when I was in Dar, I decided not peds, we're going to do general surgery. So I talked to Dr. Magohe and he was like, yeah, like I will totally get you time, in the ORs. At Muhimbili University. He's a OB guy. So he was like, I'll get you into the gen surg ORs. If we can't do that, I will get you to my ORs if we need to. And then the PI on the project is an ENT surgeon. Like if she has OR time, like we'll get you down there. So they were very invested in like making sure not only am I helping with the project, but I also kind of like get a sense of what I'm interested in. So I felt like that was helpful, like that partnership of going in there and having, and not having to reinvent anything. Like everything has already been set for you. It's just a matter of you getting to know the people you're working with and getting to know the patients that I'm working with. And something that I also appreciated on the clinical side with my colleagues who went there, like who did the pediatrics or who did the internal medicine, is that because the relationship is so good with Dartmouth, I could like join them in rounds. Like they'd be like, oh, we have like, if you get off work early, you could come join us in rounds. So like I also got to see that clinical aspect because I was not a stranger. Like they knew like this is like a Dartmouth student. Like these are good people. They could. It wasn't uncomfortable. Is what I'm trying to say. So I feel like So moving forward, like. I know I have like classmates after me who have like recommended, if you're interested in global health, like try to apply to this because I think the experience is worth it, especially if you're somebody who is starting for the first time, like never done like global health anything. I think this is a good example for a good relationship and especially if you want to stay in the field of global health, to kind of give you a good model for what to look for in the future as you move forward from Dartmouth.
Great, thank you. Hello, everyone. My name is Juliette Courtine, and I'm a senior in the undergraduate program here at Dartmouth. So for some context, I was 11 when the Center for Global Health Equity was founded, which is a little crazy to think about. But I'm so grateful to be sharing this space with you all today and to be in the beautiful Upper Valley, just talking about my personal pathway into global health at Dartmouth and just the profound impact that it has had on me. So my freshman year, I mentioned to a faculty member that I was interested in global health, and they were like, oh, you need to go over here to the Dickey Center. And so I got involved with the Global Health Fellowship Program, and I immensely enjoyed this program. It just gave me the opportunity to listen to and actually speak with so many different global health experts, which is just such an amazing experience to have at such a young age. And my interests lie mostly in vulnerable population healthcare delivery and research, specifically North American, Native American, and Indigenous populations. So one speaker that really stood out to me my sophomore year was Dr. Gwen Healy-Akerok, who Dr. Adams mentioned, who is one of the founders and scientific director of the Haliati Health Research Center. So this is a health research center based in Iqaluit, Nunavut in Canada, and their mission is to conduct health research locally in Iqaluit and with other northern communities using both Inuit and Western methodologies. So this exactly aligned with everything I was studying in my courses and everything I hoped to pursue after graduation really stuck out to me. So then flash forward to my junior year at Dartmouth, I had 2 terms off consecutively. And I reached out to Dawn Carey at the Dickey Center and said, hey, what do we think about interning with the Haliati Health Research Center? And she personally, through many emails and phone calls, very patient with me, helped me, supported me through that process, and also with the process of obtaining funding from the Dickey Center, which is also very important. So then I was able to intern with the center, and so predominantly I was based in the Upper Valley, and I was working on a survey data project examining data from the impacts of COVID-19 on community serving organizations in Iqaluit and northern communities. And then later on, I was actually able to travel to Iqaluit, which was amazing. They're experiencing a developing housing crisis, like many communities in the Arctic. So lodgings were few and expensive, but with the support of Dr. Akerok and the team back in Hanover, I was able to travel up for 8 days and have an absolutely amazing immersive experience. It was my first time traveling solo internationally. It was my first time in an Arctic northern community. It was my first official intern research experience. So many firsts, but with the guidance of Dr. Akerok and again, the Dickey Center team, it was able to be a success. And just looking back, reflecting, the work was so gratifying, but mostly what I remember is, picking fireweed plant to make jelly and helping spot seals, even though I was terrible at it and kept pointing out seaweed, and like trying traditional Arctic char dishes, and just the aspect of like engaging in Inuit culture is what I remember to this day. So yeah, it was just a very sorry. Okay. So yeah, all of that is what I think of today, and as someone primarily raised in the United States and attending a private university such as Dartmouth, I think like many of my peers, I'm constantly battling with how to use my privileges for effective allyship and to make impact in the world. And I think for undergrads, students like me, the Center for Global Health Equity was the pathway that many of us use to deeply reaffirm our values and our commitments to this profession. So I'm just so grateful to have had these opportunities given to me and to be with you all here tonight speaking about this. So thank you.
Thank you all. That was phenomenal, and I know there could have been a lot more actually for you to share, but I asked you to keep it at a lightning pace. what I want to do is certainly open it up for questions. Unless somebody has a burning question or people want to still kind of put together questions, I would love to start with one. So if I can use the moderator's prerogative here, I just want to reflect on hearing the themes that I think were interwoven through all of your experiences. There was a theme about partnerships, and again, finding partnerships that were meaningful, enduring partnerships, and then also, but really about that individualized, personal touch to your experiences, to your growth and development and education that you all got, whether it was as a medical student, as a college student here. And I wonder if there's something like that, a message for students that are here, students that are going to watch this recording. I'm sure, it'll be on YouTube and go viral any minute now. How did you make it happen? How did you find, you talked a little bit about this, about finding this opportunity, talking over with Marilyn. Should we apply? Should I apply? Am I qualified? Will I be accepted? But yeah, any advice that you have for how do you find that experience, that entry point? Because once you're in, like the individualized attention just, I think, pours down. But how do you break in, and how do you sort of make that first step to engage? Anyone can start. Don't all jump.
Well, I think I would just like to say that Dartmouth is a very unique place in that it offers an open space to be able to explore your interests and explore your passions, and it has incredible mentorship that really is hard to find at other institutions. And I don't know if that answers your question, but I would like to just highlight that the mentorship at Dartmouth is so unique, and I think that everyone is so open here and so willing to answer your questions and willing to put you in touch with XYZ person who will guide you in whatever path you're interested in. And I don't think that that's always the case at other places. So I encourage anyone, undergraduates, medical students, anyone who's interested in a project to really just email someone or reach out to anyone, because Dartmouth is very unique, and you're at a place where people are willing to listen to you and listen to your ideas and help you grow, which is a wonderful thing.
Thank you. Yeah, if I could just add to that, everything you said was exactly true. I've just been really blown away by the emphasis on undergrad attention at Dartmouth, and just thinking about how coming on this panel, even the imposter syndrome is so real, Googling everyone's bios and like, oh, what do I add here? But just understanding that, Dr. Adams and all these people, they were like, no, we value your opinion and your perspective, even as an undergrad. Like, so many of the faculty here want to hear what you're working on, what you're interested in, and I've just never felt so supported in what I want to do, even with lack of experience. They're like, we'll get you that experience. Like, we want to help you get where you want to be. And they're also very happy to throw money at you if you have an idea that, seems like it's going to pan out. That's something I've found, that they just want to support you financially, emotionally, in every way. So it's been really amazing.
And can I just say that sense of imposter syndrome never goes away, so you just learn to live with it, manage it, work around it, navigate it. No, but that's great. It sounds like it's sort of the key message maybe is send that email, reach out to that staff person or faculty member, which I really love hearing. I want to open it up for other questions too that you might be in the audience for our amazing student panel. Yes. Nareth again, another young youngish alum.
Mature.
Young yet mature alum
Yes.
of our programs. Actually, the first student to go to Tanzania on the, you did the Ford von Rhein clinical elective,
I did,
right?
yes,
Yep. And Ford von Rhein is in the audience with us tonight, too. So.
So truly a transformative experience, and I echo, and I feel this passion and energy from each one of you. I feel awkward asking questions where Dr. Binagwaho is here, and I feel like she could be talking about how to capture all of this potential that is there within each of you. And then I think as we feel about the values which seem to exist in many students in the campus, and yet you are, each of you having stepped forward, living your values and feeling connected to it. One of the hardest things, I think, though, is staying connected to both the feeling of being worthy and of being loved and being loving. And I wanted to just get your thoughts as you're each slightly different places. You're cultivating passions, you're growing passions, but do you see further ahead that people are staying connected to being loving and to feeling loved themselves? I know it's a big word in the current world, but a friend of mine written this book called Humanocracy about how we should reinvent organizations such that people are not working for the organizations, but every organization works for the people that are part of it. And I'm hoping that you have some great ideas for us about how we can do better. Thank you.
Derek always asks the easy questions.
Can we take another one along with that?
You're at the Gates Foundation. It's an organization that's filled with love.
As my 4-year-old would say, come on. Oh, really? Can we take another question? I'm not really sure how to answer that question. But I think, one thing that is that, what I'm hearing from you, though, is resonating around feeling important and feeling like you can make other people feel important, and not just important, but being part of a community. And that, there's no place like Dartmouth that does that well, to make you feel like you're at home here. Lisa, if I may tell the chicken noodle soup story. Permission. I remember as an undergraduate, I was Lisa's intern, Dr. Adams' intern, and I was really sick one night or something like that, and I hadn't shown up for work or whatever, and I hear a knock at my little apartment door on East Wheelock Street, and there's Lisa having trudged over in the cold and whatever, and she's carrying this thing of soup, and there's a side dish. I don't remember what the side dish was, but there's this big thing of warm soup, and she had brought over this soup to help me feel better. And meanwhile, I'm thinking, this is my boss at my door, bringing me soup. I'm feeling lousy, and I think that is an act of kindness, an act of community, an act of we're all in this together, an act of if you're not feeling well, even though you're doing, small little things over here, we're gonna bring you back into the fold here, and the way we're gonna start to do that is with some chicken noodle soup. But I did feel so much a part of the community in that moment, and I wasn't that I didn't before that or after that, but in that moment, it was like a gem of a moment that really has stuck with me. And I think that's, feeling that is an important employee value proposition, right? And how do you staff up a place? How do you build an institution? How do you recruit the right talent? How do you retain the right talent? How do you spin out the wrong talent, right? How do you support people on their career trajectories? You have to think about what that value proposition is to the different customers, and your employees are kind of like customers of your institution. And I think, this is a place where if I put my sort of customer hat on as like a internship seeker, it was a pretty great place to learn and grow and be oriented towards all of these incredible experiences that were yet to come. Does that answer your question?
It does about Dartmouth. I'm hoping that somebody brings you chicken soup
I'm still waiting. Yeah. And that might be a once-in-a-lifetime experience, honestly.
One of the things that I heard actually starting from Dr. Agnes, and everybody used the word at least once, some of you more than once, was trust. Talking about trust. What is one thing that you either learned at Dartmouth or experienced at Dartmouth in building trust that you now use in either your clinical exchanges or your organizational exchanges as you successfully navigate? It's another easy question.
Okay, I can start. I might fumble through my answer, but something that I have gotten from Dartmouth, especially as a medical student and as it relates to trust, is like modeling how other physicians have worked with very difficult patients or patients in difficult situations. So, for example, I did my family medicine rotation at a FDIC in Manchester, New Hampshire, where we took care of a lot of immigrant patients, a lot of patients from Congo. I got to speak Kiswahili, but like there were a lot of like language barriers. There was a lot of like patients who came in and did not like trust any recommendation that either the physician was giving or like the MA who saw them beforehand was suggesting like this is what's gonna happen in this appointment. And I remember like, and this is not just this one attending, like I've seen multiple attendings and residents do this. It's kind of like taking a step back and not looking at it as I'm a doctor and you're my patient, but almost like you're my neighbor type of conversation. So seeing that modeled as a medical student several times and seeing other medical students, including myself, like when we deal with patients, like doing that step back, it's one skill that I've definitely appreciated, at least getting from my medical school. And to answer your question about the loving thing, I feel like something Dartmouth has done well, and I don't know how, at least from the medical school side, I don't know how you decide who gets to be a Dartmouth medical student, but however way it's decided, I think it's perfect because, well, not just because I'm here, but like when I got accepted and I was coming to Hanover, like Hanover, it's rural. I did not expect that there would be a lot of Black people here, but the friends I've made in my class, like, are my forever friends. Like, I could talk to these people about anything. And even the ones who are now in residency, like, still calling me, telling me about their rats. So whatever Dartmouth is doing in terms of, like, how we select our students, I think really adds to that community feel, even when I have every reason to feel like I'm isolated here. Did not really feel that when I was around my classmates.
If I could just jump in quickly, I'm from a small town in New Hampshire, and Hanover was actually the big city, and we would come here to like go to the movie theater and to live it up a little. So it's funny you mentioned like rural New Hampshire. It is though. And then to answer the questions about trust and love, which I think are so intertwined. I think we do a great job of selecting students at every level and also faculty at every level, because there's so much trust in that bond, as well as like the student and the faculty, the mentee and the mentor. And I know, again, like as traveling for the first time alone internationally, I placed a lot of trust in the Dickey Center and Don Carey and everyone back home to, you know, support me through that process. And then at the same time, when I was up in Iqaluit, Dr. Akarak was like, do you have your hat for today? Do you have your gloves for today? Even though it was August, right? And so I knew, like, I felt that trust and that love in both places. So it's really pervasive, and I think it kind of bleeds out from Dartmouth and all these communities we have partnerships with.
Can I ask a slightly different question? It sounds to me like you're all very lucky to have gone to Dartmouth. I never went to Dartmouth. They wouldn't let me in. So so this is a real question. So the question is, I've heard you speak over and over about mentorship. So think about the world now, where there's a lot of online classes, where sometimes, again, I don't know Dartmouth, but many places, professors will come in, teach a course, and leave. So there is not that kind of mentorship. How do you think you would deal with an online course? Or how would you reproduce that kind of mentorship in a course that's not just physically together?
I would definitely use office hours and promote. Are we talking as the professor? Yeah. So I would definitely open up as many sessions of office hours and individual one-on-one time to sort of replicate the mentorship that we had here. Because I think that it is intimidating on an online Zoom when you have all the windows and you see everybody, and you may not want to ask a question on the Zoom, or you want to have an in-depth discussion with the professor, or you want to ask them about their research. As the professor, I feel like being very open and having individual slots for office hours would be a great way to sort of foster that mentorship.
I'll just share one little anecdote to that that sort of combines a little bit of what you were saying, and that is that this long before our Zoom times, Dr. Agnes mentored me 3 months before I even moved to Rwanda. I think we started working together online, virtually over email, but I felt mentored by you. You were teaching me, you were helping me understand, giving me more skills to have a learning orientation so that when I did arrive a few months later, I could jump in a little bit more, or at least understand the context. And I did feel that mentorship. And now I think, I mean, I'm not in higher education, but there's so many new tools and ways to have those types of experiences through other workarounds. I just gave a talk earlier today, and we used this like poll everywhere, I don't know. And it's a QR code, and everyone can click it and fill the thing out in real time, and then you can actually present the data in real time. I'm sure other people are way better at that than I was today, but it is really an amazing experience. And then pulling in sort of student information from that, you can create opportunities for continued engagement through all kinds of, whatever, social media or whatnot. But I do think that, I know when I worked for you, Dr. Agnes, in Rwanda, there was so many, the digital interface that Rwanda pioneered across its health system was also reflected in the higher education system. And I think a great example of that is actually UGHE. Where there's a lot of the University of Global Health Equity in Rwanda, where there's a lot of digital learning, a lot of cross-pollination across different schools, and I think actually I wasn't going to make this point, but I think I will now that looking out the window a little bit more to what other countries are doing, and maybe opening the aperture and taking pages out of books of places that are less well-resourced than other places, because that's actually where a lot of innovation happens. So, my 2 cents. Haven't figured that out yet.
We're working on it. Great, thank you. I want to wind up this evening, but just to reflect a little bit, again, I love these themes that are coming out on mentorship, on trust, on authentic partnership. And what I'm sort of hearing too is that, those are the values of our center, certainly, and the way we approach our engagements in global health equity, but also just that secret sauce that Dartmouth is a place where you are seen, you're seen as an individual, and a place where you can build community, and a place that has your back. And I really, that's actually a perfect segue for me to acknowledge that Dean Dwayne Compton from the medical school is there in the back row. And for me, as the director of the center at Geisel, he's had my back. And so a thank you to Dean Compton for your support through the years. We couldn't do any of this without your support, and so I would be remiss if I didn't acknowledge that. And with that, please join me in thanking all of our panelists, our keynote speaker, Dr. Agnes, and all of you for being part of this evening. Thank you.